You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you to the October 2025 edition of Editor's Summary. This week's featured interview is by Associate Editor Dr. Proton Rahman, who discusses the paper Prevalence and Predictors of Achieving Sustained Remission in Psoriatic Arthritis, a Swedish nationwide registry study, and it is by Drs. Olafur Paulsson and Mihalia Kapanovic on behalf of all the other co-authors.
Our major results, show that a considerable proportion of patients with PSA receiving various advanced DMARD therapies never even achieve remission, and approximately half of them never achieved a sustained period of remission. Fewer swollen joints at first biologic or targeted synthetic DMARD initiation, it increases the likelihood of a sustained remission, and we even had signals that men were still more likely than females to achieve sustained remission.
I hope you enjoyed listening to part of Dr. Rahman's interview with two of the authors of the paper Prevalence and Predictors of Achieving Sustained Remission in Psoriatic Arthritis, a Swedish nationwide registry study, and we'll listen to the full interview, which is available at our website, www.jroom.org, and on our YouTube channel. Now, moving on to the other articles in the October 2025 edition of the Journal of Rheumatology. Next article to bring your attention to is by Esther and co-authors and is titled Priority Setting of Physical Activity Barriers and Facilitators Among Individuals with Rheumatoid Arthritis, a Nominal Group Technique Study. The aims of the study were to understand key physical activity determinants for people with rheumatoid arthritis and to map these determinants using the behavior change wheel to guide theory-driven intervention development. The nominal group technique of 14 people with RA identified 22 physical activity barriers and 25 facilitators for physical activity. The top three barriers were unpredictable disease fluctuation, fatigue, and lack of RA-specific physical activity knowledge. The three top facilitators were motivation to maintain function, physical activity knowledge, and physical activity self-confidence. Theoretical mapping led to 3 capability-related, 6 opportunity-related, and 4 motivation-related determinants. The author suggested that the interventions for physical activity should specifically target these areas. Screening for breast, cervical, prostate, and colorectal cancers are important to all people. And in their article titled Cumulative Incidence of Cancer Screening for Breast, Cervical, Prostate, and Colorectal Cancer in Patients with Rheumatoid Arthritis, Brooks and co-authors examined screening rates for these specific cancers in 1,614 patients with RA and compared the rates to 1,597 matched comparators without RA. After 5 years of follow-up, 51.6% of the RA cohort had cervical cancer screening compared to 58.2% in the non-RA cohort, and the difference between the groups remains significant after adjusting for age, smoking, and race. In contrast, there were no significant differences of the rates of screening for breast, prostate, or colorectal cancers between the two cohorts. There is an ever-increasing use of social network worldwide. In their paper titled Trust in Health Information Sources Among Patients with Systemic Lupus Erythematosus in the Social Networking Era, the Trump 2 SLA study, Ichikawa and co-authors examine how the availability of health information could influence patients' interaction with healthcare providers. In this cross-sectional study of 510 Japanese adult patients with SLE, 98% of the respondents expressed trust in doctors, while trust in websites or blogs was seen in 52%, and trust in other social networking service was the lowest at 26.8% of the patients. However, the internet was the most frequent initial source of health information in 45% of the patients, and the websites looked at included medical institution websites, patient blogs, X, and Instagram. People with highest internet use was associated with the greatest trust in websites and blogs and other social networking service. Higher functional health literacy correlated with an increased trust in doctors and a concomitant decreased trust in websites or blogs and other social networks. While higher community health literacy was linked to a greater trust in doctors, websites, and blogs. The Childhood Arthritis and Rheumatology Research Alliance, or CARA registry, is a North American registry of children with rheumatic diseases. Salu and co-authors for the CARA registry investigator characterized 306 patients diagnosed with juvenile psoriatic arthritis within 6 months of CARA registry enrollment in their paper, which was titled Juvenile Psoriatic Arthritis Inception Cohort in the Childhood Arthritis and Rheumatology Research Alliance, CARA registry, characteristics and early disease. The 306 patients were predominantly female at 63%, with a median age of onset of 11 years. At enrollment, 52.3% had polyarticular course disease, 20.1% had enthesitis, 34.3% had dactylitis, 9.5% had active sacroiliitis, and 58.8% had psoriasis. Tumor necrosis factor inhibitors were used in 61% of the patients and other biologic DMARDs in 13.4%. The disease activity measure, the CJDAS-10, improved from a median of 10 at baseline to 1 at 24 months. Improvements were also seen in active enthesitis and active sacroiliitis. The presence of HLA-B27 is included in the spondyloarthropathy classification criteria and in referral strategies for axial spondyloarthritis. McDermott and co-authors in their paper titled HLA-B27 Testing in Clinical Practice, a retrospective analysis of testing indications in rheumatology referral patterns, examined the reason for HLA-B27 testing and who sent the requisition for testing in a cohort of 1,960 patients who were tested over a 1-year period in the Massachusetts General Hospital healthcare system. 62.4% were female, and the average age was 47.4 years. The most common specialty ordering B27 testing was rheumatology at almost 40%, followed by ophthalmology at 21.4%. The most common indication for HLA-B27 testing was peripheral arthritis in approximately 1/3 of the patients, uveitis in 22%, and back pain in 16.7%. In the majority of patients, 69.3% who had HLA-B27 testing, they also had other autoantibody testing. A total of 10.9% of the tests were positive. Almost half of the HLA-B27 positive patients were not referred to rheumatology. In accompanying editorial, Doctors Beaufrère, Chéricourt, and Constantino from the Hôpital Ambroise Paris, Université Paris-Saclay, Céda, France, titled HLA-B27 testing, what HLA-B27 can and cannot tell us. They review the history of HLA-B27 and give their perspective on the appropriate use and misuse of this test and how to improve the rate of appropriate testing. Diffuse idiopathic skeletal hyperostosis, or DISH, is characterized by calcification and ossification, predominantly affecting the axial skeleton, and has been associated with obesity, diabetes mellitus, and hypertension, all of which are important in the pathogenesis of metabolic syndrome. Kiefer and co-authors in their paper titled Influence of Obesity on Radiographic Changes in Patients with Diffuse Idiopathic Skeletal Hyperostosis examined spine and or chest radiographs in 124 patients to determine the presence of metabolic syndrome and obesity in the cohort. 42 of the patients had DISH, and they were compared to the 82% of patients with degenerative changes on a radiograph, but not consistent with DISH. The mean BMI of patients with DISH was 39.8, which was similar to patients without DISH, which was 40.7. Similarly, patients classified as pre-obese, obesity class 1, 2, and 3 were similar in the two cohorts. 1/3 of the patients with metabolic syndrome were classified as having DISH, and in particular, obese metabolic syndrome classes 2 and 3 were significantly associated with radiographic spinal changes consistent with DISH. I will now bring your attention to a study of quality in two chronic rheumatic diseases that have not been frequently studied. Paper is titled Quality of Life in Adults with Sappho Syndrome and Chronic Non-Bacterial Osteomyelitis and Comparison to Chronic Rheumatic and Inflammatory Diseases, and the authors are Leonard and co-authors. The effects of Sappho syndrome. The authors assess health-related quality of life in 138 patients who were in the U.S.-based Sappho CNO prospective registry and compared their results to results that they obtained from reviewing the literature of EQ5D among patients with chronic rheumatic and inflammatory diseases. The mean disease duration of the Sappho CNO patients studied was 6.2 years, and the mean EQ5D5L index was 0.7, and the mean EQ-VAS was 63 in this cohort. Pain or discomfort was present in 86% of the cohort. 65% had difficulty in carrying out usual activities, and anxiety depression was seen in 54%. Over 1/3 of patients reported problems in all 5 EQ5D domains. The literature review by the authors showed that adults with SAPHO-CNO had similarly reduced EQ5D and EQ-VAS scores, and similar high proportion of perceived problems. Access to rheumatology education and patient care is limited in many African countries, which leads to suboptimal care and poor outcome for patients in these countries. Visual education is a feasible means to deliver curricula remotely. Hitchin and co-authors for the All Rwanda Program Group, in their paper titled Implementation and Evaluation of Virtual Rheumatology Training Program in East Africa, reviewed the evaluations of 55 residents and 7 instructors who participated in their annual 16-week virtual rheumatology program, which was delivered to internal medicine residents in Rwanda between 2021 and 2024. Overall, the residents liked the program but had concerns regarding not enough time for case discussion and lack of in-person teaching. One other major concern was that the course conflicted with clinical duties, which prevented most residents from attending all lectures. The authors concluded that a virtual rheumatology course is feasible to deliver medical education to medical trainees, but in-person education is still required. In an accompanying editorial titled Developing Rheumatology in Sub-Saharan Africa, Addressing the Challenges, Dr. Robert Moot from Liverpool University's Hospital, NHS Trust, Liverpool, United Kingdom, reviews the challenges and progress made in providing rheumatology education to underserviced areas. Our expert review this month is by Drs. Hagen, Lawrenson, Mulrooney, and Matheson from the Center for Treatment of Rheumatic Diseases, Diakonhjemmet Hospital, Oslo, Norway, and is titled Inflammation as a Treatment Target in Hand Osteoarthritis, a review of previous studies and future perspectives. This month we have one systematic review and meta-analysis, and is by Go, Garisto, Cunningham, Go, Hamilton, and Feldman from the Division of Rheumatology and Endocrinology, the Hospital for Sick Children, University of Toronto, Toronto, Canada, and is titled The Effects of Juvenile Idiopathic Inflammatory Myopathies on Growth, Development, and Maturation, a systematic review and meta-analysis. Our article this month for Panorama 360 Degrees of Rheumatology is titled The Stars Align, the Incredible Discovery Story of Vexus. We have 2 interesting images in rheumatology this month. The first is titled Arthritis Mutilans in Psoriatic Arthritis, the Consequences of Delayed Treatment. And in the figures, they illustrate severe destructive arthritis involving the jaw, hands, and fingers of a woman who presented late during the course of her arthritis. The second image is titled Pyoderma Gangrenosum Associated Autoinflammatory Syndrome with Skin Abscesses, Successful Treatment with Interleukin-1 Therapy. And the photographs show the before and after effects of anti-IL-1 therapy in a patient with Pyoderma Gangrenosum Associated Autoinflammatory Syndrome. We have two research papers. The first is titled Risk and Time Course for Autoimmune Rheumatic Disease Development in Patients with Raynaud Syndrome. And the second is titled Endothelial Cell and Neutrophil Activation in Untreated Intercircuital Gout Patients. There are two case reports this month. First is titled Otolin-Related Autoinflammatory Syndrome with a novel mutation treated with tumor necrosis factor inhibitor therapy, a rare case report. And the second is titled Refractory Sclerosing Mesenteric Panniculitis presenting with macrophage activation syndrome, successfully treated with rituximab. I want to thank you for listening to this podcast and encourage you to read the complete articles in the October 2025 edition of the Journal of Rheumatology. The articles are available either in the print or online edition of the journal, the latter of which is available at www.jrheum.org. I encourage you to watch the interview by Dr. Rahman of our highlighted article and also previous highlighted articles if you have not had the chance. They are available for viewing at our website and on our YouTube channel. If you have any questions or comments of any of the articles in the Journal of Rheumatology, please send them to manuscripts@jrheum.com. Please join me next month for the November 2025 edition of Editor's Summary, and I want to thank you for listening.